Hello, it's me, Dr. Britton Bradberry again, here at Advanced Veterinary Care in Silver City, New Mexico. In the video today, we're going to go through the common questions that I get concerning a dog that has a cranial cruciate ligament injury. During this video, you're going to hear me refer to the cranial cruciate ligament as the CCL, the ACL, or a generalization of calling it the dog's knee. Some of the common signs that we see with a dog that's recently injured its cruciate ligament is a reluctance to fully bear weight in one of the hind legs. We may see them kind of trot along, picking it up. We may see them use it here and there. When they go to sit, we may see them kick that leg out or even put it underneath them when they go to sit down. Another thing we oftentimes see is a patient who will lay down for a period of time, and as they get up, they're really hesitant to use that. If you suspect that your dog has recently had an injury to its ligament, I would recommend going to the veterinarian. Once there, your local veterinarian is going to go through a physical exam, and a couple of things they're going to look at is what we call cranial jaw motion or tibial thrust. Sadly, if a patient is positive on either one of those exams, then your dog does have an injury to its cruciate ligament. Once you're at the vet office, your veterinarian will come up with a couple different options to discuss with you when dealing with a patient that has a cruciate ligament tear or injury. It is recommended that the patient does have surgery. There's a variety of options that are non-surgical, but I'm going to go through why those aren't the best thing for the patient. When a dog blows its ACL or its CCL, there's a great amount of force on that knee joint. With a human, we can try to repair the actual ACL. Oftentimes it's done with hamstring tendons or cadaver strips. In the dog world, sadly, we can't fix the ACL or the CCL itself. Therefore, we have to come up with some pretty creative ways of fixing the leg without needing the ACL. If the patient has had a full tear, it's pretty obvious that they can't bear weight. But a lot of times the veterinarian will diagnose, especially in a very large dog, that it's what we call a partial tear. When we get in there surgically, it's rarely a partial tear. It's usually a full tear. The big dog just didn't have the luxury of keeping that leg up, and therefore they did bear weight on it, and a lot of scar tissue developed in there. There's a variety of braces, or people oftentimes even talk about stretching or just waiting. If you wait long enough, the dog will use that leg again. That knee joint is going to be full of scar tissue. The ACL is not fixed, it's not repaired, and the patient develops a great amount of degenerative joint disease as well as osteoarthritis, which in turn is a great deal of pain. Why is the dog still using the leg? Well, dogs are much tougher than you and I. And so without proper surgical intervention, the dog's leg will begin to tweak out a little bit. This not only causes more arthritis in the knee joint, but also starts to affect the hip joint as well. I see a fair amount of dogs that come in years down the road with what they assume is hip problems, and it is, but it's because the knee joints were never addressed. The ACL's tore probably 2 or 3 years earlier. The dog started running and playing again within 3 months, and the owner thought everything was fine. So in a perfect world, I would recommend surgical intervention on all of our patients with cruciate ligament tears. Now this is where it becomes a little bit more tricky. Sadly, there's not a one-size-fits-all, and this can be controversial in its own sense. A lot of veterinarians, specifically surgeons, have a preference to a specific surgery, myself included. However, dealing with smaller breed dogs is a lot different than dealing with large breed dogs. In a small dog, sometimes we can get away with doing kind of an older extracapsular surgery. With large breed dogs, it doesn't work as well. And when I speak of large dogs, I generally mean dogs over 40 to 50 pounds and upwards generally need what we call a geometry modified technique. That means that we end up cutting the bone, we realign it a specific way, we place an implant or of some kind to stabilize the bone and allow it to heal that way, and therefore the dog can walk, keeping everything aligned without actually needing a cruciate ligament. My surgery preference, especially for the larger dogs, is what we call TTA2. It's the tibial tuberosity advancement. And what happens is we take the tibia, or the bottom part of the bone that's connected to the knee joint, we make an incision into the actual bone, very specific and unique to that dog. We place an implant or a cage in there that pushes the tibia forward, and then we allow bone to grow through that implant. The reason I prefer this over other surgeries is really there's a decreased chance of infection, decreased healing time, and decreased complication rate. On our website, we have a list of post-operative instructions. It goes through all the basic do's and don'ts if we're going to do this surgery. A couple of the key points are leash walks during the entire 8-week process. Now, week 1, the patient is dealing with just having a pretty major surgery. So their walks may be limited to 5 or 10 minutes, going outside to the bathroom and coming back in. Over that 8-week period, we can build up their walks where they may be going a 2-mile walk, they may only be going on a half-mile walk. It's not a race by any means. The other thing we want to watch for is doorbells. I hate doorbells when it comes to orthopedics. Why is that? The patient's sitting there resting comfortably with you, the doorbell rings, they jump up and start barking and running at it. This puts a lot of strain on a recent surgery and can cause some complications. So I tell people, you're going to be the expert when it comes to dealing with the dog. Perfect world, we'd like to just kind of put them in a cupboard and hide them for 8 weeks. That's pretty unrealistic. However, if you have a patient that has a lot of anxiety, this may be a patient that needs to be kennel trained during these 8 weeks. It may be one that, is pretty laid back and you can watch them the entire time and they listen to you greatly. We have a couple dogs personally, and I can tell you that one tolerates surgery great, the other one, not so much. So I really like to focus that instead of looking this as an ACL surgery, I like people to look at it as a fracture surgery. Obviously, we're going to cut into that bone, and that's the most important part, is that healing again. So I tell people, don't let them do anything that you wouldn't let them do with a broken leg. So the day of surgery can be kind of nervous for the patient and the owner alike. So I like to kind of go through that because that's a common question that I get as well. We usually like to see the patient the morning of, fasted of course, so that they can go under anesthesia. We make sure that we're all on the same page and that this is the proper surgery for this patient. After the surgery itself is performed, we do keep the patient overnight. There's a couple of reasons for this. We like to observe the patient and see how they tolerate coming out of anesthesia. We give the patients epidurals. This is really important to us. 1, it makes sure that they're not feeling any pain. But 2, it allows us to use a lot less anesthesia, which is much safer for the patient itself. And 3, it's very difficult for me to send home a patient that really can't move its back legs. I'm okay with that. If they can't move those back legs, it's because 1, they're not hurting, but 2, they're also not going to mess with it. They're not trying to lick at it. They're not trying to get up on it. And so really they just sleep it off. But of course the next morning after surgery, we can send the patient home. That morning that we discharge the patient, they will be sent home with e-collar or a cone, obviously to keep them from licking. They're placed on antibiotics because we've opened up a joint as well as a bone. They're sent home on a variety of pain medications. Why? There's not one that just magically covers all of our bases. All of these pain meds are very safe and can be given in combination with one another. They oftentimes are toe touching. Some of them are even using the leg. Some of them have a decent amount of swelling. Again, that's where the icing and the massaging comes in and will make a difference. But all in all, the patient is always happy to go home to you. So at 2 weeks post-op, we really feel like it's important to see how the patient is recovering. I like to see the incision. If you're out of town, then you can send me a text message of the incision. If you want to send me a video of the patient walking, that's even better. But that allows me to address, is the skin healed properly? Can we take the E-cone off? At 4 weeks out, we like to have a lateral x-ray. This is really important to us. We get to see if bone is starting to develop properly at the most bottom part of that cut. If there's not enough, we may need to increase the rehab or the walks a little bit more. If it's way too much, we may have to address, hey, pull this patient back. We're letting them do too much. At 8 weeks, we also like to have another lateral x-ray. This is the exciting one. We get to see how much bone has grown through the entire implant. And 99% of the time, it's good. At that point, we allow the patient to resume normal activity and they can go on having a healthy half-beat life pain-free. So in conclusion, we made this video that we could help address some of the common concerns or questions that folks may have when dealing with a cranial cruciate ligament injury. But I also try to tell people that if we do this surgery, I always feel that my name is connected to this dog for the rest of its life, and I'm okay with that. So if we go forward with the surgery, we send folks home with a packet that goes through all the do's and don'ts, but you'll also have my cell phone. And I tell folks, if you need to call me, email me, text me with any kind of question or concern, please don't hesitate.